everybody? It is your girl Tina, aka Tina versus Sickle Cell, and I am going to be doing a little bit of a different video from what I normally do. This is going to be more of an informative video, and then also I'm going to tell you about my journey. This video is going to be all about a new medication for sickle cell, for treating sickle cell, called, I got my notes, bear with me, hold on, crizanlizumab, TMCA, or you can call it Adakveo. When I go to the infusion clinic, they call it Criz, but I just call it Adakveo. And this is from the parent company, Novartis. Now, as I just showed y'all, I got notes, okay? I have been getting messages ever since I started this journey. I just got my last dose, what was it, last week? And let me not say last dose. The last dose I had was last week, and that was my 6 months dose. So I wanted to wait. I thought about doing this, like, okay, I should do this as soon as I do it. I should do what I think about it. Maybe a couple months in. No, I really wanted to wait and give the medicine, number one, a chance to show and prove. Number two, I wanted to be sure that I knew what I was talking about, because I can tell you all about my journey. I can read off a script, and I cannot tell you about somebody else's experience with the medication, because I'm not somebody else. So what I wanted to do, before I just sit up here and rattle off, this is what happened to me, and this is month 2, month 3, you know, before I sit up here and do that, I want to give y'all some real deal background, because there's been some people, surprisingly out of the United States, more so, asking me about this medication. So I got some pictures for y'all. I have some video from me actually having my Adakveo infusion going. I'm gonna try my best, because y'all know I like to talk to y'all. I don't want to just be reading from a script, but this is extremely important to me and my community. So I want to be as informative, as I can, without anybody getting bored, anybody feeling like I'm, a robot. Let me go ahead and say this. Nobody is paying me. I have not been contacted by this company. I have not received any kind of checks, any kind of requests for endorsement, promotion, sponsorship, whatever. This is just strictly Kentina Marie Moore telling you my journey and my story with Adakveo from the parent company, Novartis. So let's get into it. Number one, y'all might be, you may be a caretaker, you may not be a patient directly, you may not know what this is. So let me start from the very beginning. Let's go ahead and start with sickle cell disease. I'm not talking about any specific trait. Of course, I have SC disease, or SC disorder, as you want to call it, but this is gonna be a broadband over what is a sickle cell pain crisis in general. So I used to think that it was just the cells getting together and they just clump up, just the blood cells, the sickled cells, they just clump up in a blood vessel, and this could be your blood vessel, and they just clump here and the blood can't flow, and that's where your pain is. Doing this research, I learned that it was actually much more than just that. So I learned that the reason that the cells stick together is because of a a protein here called p-selectin. And p-selectin is important because it is in the blood vessels themselves. It is what adheres the platelets and the white blood cells together. If you have a wound, or you have an injury or something like that, or if you have inflammation, those are where those p-selector receptors are going to be, and it's actually necessary for healing processes, okay? Because I was like, well, why do we have it? Why do we need it? Can we get it up out of here? But no, it's very necessary for that process. So with that being said, the p-selectin protein itself is very sticky. So it's, in the blood vessel, it's sticking up, and it's going to cause the platelets, of course, blood platelets, red blood cells. It's going to cause the white blood cells if you have an infection or inflammation. It's also going to tack on to those damaged and those sickled cells and cause them all to get stuck together. And once they get stuck, they clump up and they cause blockages. Well, here is where I'm gonna call it Adakveo or Kriz, so bear with me, it's all the same medication, okay? Here is where the medication comes in, and I will tell you from Novartis itself, it is described as a protein antibody that acts as a selectin blocker and is designed to reduce the frequency of vaso-occlusive crises, or pain crises as we call them. It's a targeted biologic that works by attaching to the p-selectin protein and blocking its attachments to the red blood cells, white blood cells, and platelets. So here's the thing. You got the p-selectin in the cell, in the blood vessel, I'm sorry. It's necessary to be there. However, because of the way that our blood is designed, you also have those damaged and those sickled cells that come and they're just floating along doing what they're doing, they get stuck. So when they get stuck, as it says, vaso-occlusive, some of y'all may not be familiar with that term. I'll tell you right now, I'm 29. I didn't learn that term until I was maybe 27, maybe 28, something like that. So I'm going to try and break this down into layman's terms, Tina terms, bite-sized pieces that we can really understand it. So basically, you have the p-selectin making the cells sticky, making them stick together, clump up, causing us pain, causing inflammation, and that's where we get our pain crises, pain episodes, as some people may call them. Adakveo has created this drug, this medication, to come in and basically block that p-selectin protein so that the cells, I wish I had I need a piece of paper, so that the cells are not sticking to it. It comes in and it kind of caps off that p-selectin protein so that the cells are able to go on about their merry little business, okay? Well, that is how it is supposed to work. That is what it was designed to do. Now let's talk about results from the company itself. So this is the study that they had, and let me get back to what I was saying. My doctor put me on this medication, recommended this medication, and basically she knows me. She knows I'm gonna go in and dot my I's and cross my T's doing all my research before I start taking something. So she basically said, hey, this medication, it's new. Keep that in mind, but there's research out there, there are results out there. I want you to really look at it and see if this is something for you. When I went to look at the medication, because on the site, again, it says that for people who have 2 to 4 or 4 to 5 pain crises per year, it is designed to cut their pain crises or vaso-occlusive crises down by almost half, like 45 and change %. That had me sold. I was like, what? If I can take out half of what I go through in a year, you got me. I'm sold. Just because my pain crisis now, like as I said, I'm 29. For the last 5 or so years, my pain crises have been more frequent. They have been way worse. They've been harder to control in the hospital. They've been kicking up with my asthma and any kind of infection I have. I'm smiling, but it's been pretty rough. So that was something that, no, it's not 100%, it's not 80%, but 45% is better than nothing. It's better than the options that were out there before. As some of you might know, I do not take hydroxyurea. I will not take hydroxyurea anymore. I've tried it in the past. It did me completely dirty, okay? Like, I was extremely sick. I lost a lot of weight. I got infections like crazy. I had pneumonia and flu and all of that stuff, like back to back to back. So that was not a medication that was designed for me. Not to say that you should not take it. Consult with your physician. It works wonders for some people. It doesn't work well for others, and I just happen to be that other. Anyways, back to the facts. So let me say that I just told you what they said, and within a year it was designed to cut the pain down by almost half, like 45%. It said that the studies were conducted across the United States, including different ethnicities and genders, and the medication was also tested on people who took hydroxyurea and those who took over-the-counter pain medicine and opioid pain medicine. So let me say why this is important to me. As I just said, there's people who are already taking hydroxyurea, and this medication has been out for a long time, okay? If you've been on this medication for a long time and you are still suffering, 2 to 4, or 5 to 10, I'm sorry, which is where I'm at, a year for your pain crises, this is something that you're like, okay, I'm either going to add it to my regimen or I'm going to switch it. It was also important because their participants were not forced to stop taking their pain medicine. Like, if you need your pain medicine, go ahead and take it, but we're gonna include this on top of it. Now let me say this also. It is a once a month treatment, except for the first dose, or the first month. The first month you get what's called a loading dose. So you get 1 dose, you come back 2 weeks later, and you get your second dose. After that, it is just once a month. I will leave that open because I'm not sure how long we're supposed to be taking this medication. I'm not sure if it's one of those forever things, if it's we take it as long as you need it. I'm not sure. That was not stated on the website, and I'm sure because it is such a new medication, that information is probably not available right now. So let's see, who is it for? It is listed for teens and adults who are 16 years and older. Studies have not been conducted on those who are under 16 and those who are pregnant or breastfeeding. So if you are pregnant, if you are under 15 and breastfeeding, something like that, it is, I won't say it's not recommended because I'm not a doctor and I'm not a scientist. So I would just say use extreme caution. Of course, talk to your doctor. This is not something, let me answer this too. I had a question from someone out of the United States who said, like, well, I'm gonna try to obtain the medication and take it myself. So this is something that I go into the infusion clinic for, or my hematology clinic for. It is an IV infusion. As you see in the video later, I'm going to show you how they access my port and, the medicine going through the line, everything like that. I do not need pre-meds for it, and I will tell you right now, I am a very allergic person. I won't say like I just have horrible allergies, but I'm allergic to a lot of things. I won't rattle them off, but I'm allergic to a lot of things. I don't have to take a pre-med. I don't have to take any kind of like Tylenol or Benadryl, anything like that before I take the medicine. Keep in mind, I keep saying me. I'm not speaking for what you may or may not have to do. I have not heard that anybody else has to take a pre-med with this medication. But then again, we don't know everybody's allergies. Ooh, Jesus, we will get to the side effects. Give me 1 second. Again, I was saying that you have to go to the hematology, or maybe if you're in another country, I'm not sure how that works, your physician's office. It needs to be administered by a registered nurse. Like, they literally check me in when I go in. I can show you the paper. It says for chemo visit. So I have to go into a certain part of the clinic for that. I'm not saying that it's chemotherapy. That's just how it's labeled. Saying like you can't go to your regular doctor and get this medication. That's what I'm saying. All right, let's get to the side effects as quickly as I can. This is very important. Like, I need to put a big sign, skip here, for side effect information. Okay, I will show you really quick. Y'all can see the red, and then there's one that's green outside of the black. everything that is in red is something that I have experienced, which is a little bit alarming for me. It's not that bad. Obviously, I'm sitting here and I'm talking to you. I've had to take some pain medicine. I'm in the middle of fighting a pain crisis right now, but we gonna muscle through it. But let me tell you about the side effects, okay? So it says after the first 24 hours, you may look for fever, chills or shivering, nausea, vomiting, tiredness, dizziness, sweating, hives or itching, shortness of breath or wheezing. Now, out of that list, let's see. Let's count off the ones that I've had, okay? Let's say chills or shivering. Out of completely nowhere, it blindsided me to just be like shaking, and I was cold, like not even cold, just shaking and sweating, and it was crazy. It bugged me out so bad. Nausea, I get nauseous from a lot of things, like my pain meds anyway, so that's kind of on the list, I guess. Tiredness, after the first maybe day or so, I was just, I can't do it. I just can't. I can't. Not today, okay? After that, maybe first 2 days, I was all right, back to normal. Dizziness, I kind of get that, just, you know, like vertigo anyways. Sweating. The sweating and the shivering scared the mess out of me. Like, how am I shaking? Shaking and sweating at the same time. I did not understand that. Hives, not really. Oh, wait. I have been having random hives like on my arms and my legs and itching. I wonder. Okay, that I just realized that. Okay. Shortness of breath, no. Wheezing, I have asthma, and there's been a couple instances that I've had an asthma attack out of nowhere, and my asthma's been fairly controlled for a while. So let's see. The common side effects are back pain, joint pain, nausea, and fever. Out of those four, which are the most common side effects, I will say I've had the back pain like crazy, and joint pain, and again, like I said, nausea is just kind of my norm. So let me be sure to say that from the site and from other research that I did, these are not all the possible side effects. I will tell you my specific side effects from the common ones. Back pain. Man, when I tell you, I have never experienced anything like that. I've had pain in my chest and my joints, my hips, my stomach. But that back pain, so after the first dose, it took about 3 or 4 days for it to kick in, and it came out of nowhere, and I was like, what is this? Like, so bad that I had to go to the ER. The next dose, it kicked in the next day. When I say next dose, I mean the second month. So month 2, it kicked in the next day. By month 4, I will say that number 1, I was expecting it. And number 2, I got with my hematologist, and she told me to start back on the gabapentin. Which gabapentin is a nerve medicine, or it works. It's like a nerve pain medicine, something like that. So it helped to, it didn't take it down to 0, but it took it way down. So that was a help. One thing that I would say I dealt with in the past, if you have a lot of pain medicine and different medicines and stuff like that you have to take, unfortunately, you may experience some like stomach pain, like gastritis or ulcers, something like that. I had gastritis and the pain due to the pain medicine, different medicines, and it has come back with the vengeance. So I am taking Carafate. Should have wrote that down. I've been taking Carafate. I'm supposed to be every 4 hours, but that's hard to work. It really is. So let me see. Is there anything else that I want to tell you guys? Most important thing, aside from what I just told you, my specific journey. No, let me say one more thing. about my journey specifically. As I said, it took about until the fourth round for me to, number one, figure out, okay, these are side effects from this medicine. Two, is this doing anything for me? Because month 3, I'm like, dog, I done had a crisis every single month. Nothing's happening here. They actually told me to give it between 6 to 9 months. So like, 1 to 6, don't count that as anything. 6 to 9, that's when you start really like, okay, let me see if I notice any differences. Let me think. As I stated, I have had, 6 months, at least 3, maybe 4 pain crises that resulted in me having to be admitted. And when I say admitted, it's been a while. Like, my last admission was 11 days, I think. The one before that was like 9 days. So it's that's kind of neither here or there, but I'm just saying I haven't felt what these people are saying, where they say like, oh, I haven't been in the hospital at all. So yeah, I've had about 3 to 4 in the last 6 months. I've had about 3 to 4 pain crises resulting in me going and having to be admitted. The first couple months I was still having the bad pain. Like, my pain, I have pain every single day, I'll say it like that. Varying degrees of pain. It's usually worse early morning or in the evening after a whole bunch of activity and having to live your life. So have I noticed, this is month 6, have I noticed anything? I will say that I have noticed a change, because I have been having daily pain, but I haven't been having, during the span of the month, the amount of pain that will drive me either to having to go to the infusion clinic or to the hospital. I mean, to the ER, not be hospitalized, but to the ER more than once during the month. It's been to where I can either manage it or I cannot. There's not been any like really bad spike in pain, crying in a ball, and then you kind of get over it type things. So for that, I would say that's a bit of a difference. Is it a brand new world, bright and shiny, the way I expected it to be difference? No, not yet. I'm still optimistic, and I truly, truly, truly hope that one day it will be, a really significant change. But as to right now, just me being completely honest, I have not noticed a grand overwhelming change. And as I stated, I have had side effects. I have informed my doctor. If you have any side effects, any issues, anything like that, please talk to your doctor. You can even email Novartis. They said that they want for people to reach out for them, especially with new medications. Tell the people if you're having a major issue. But yeah, I mean, it's, even with the side effects, even with still having to be hospitalized, it's a once-a-month trip to the infusion clinic. Yes, it takes me all day because of where I go, but it's a 30-minute infusion. Let me say it's only 30 minutes. And you're in, you're hooked up, you're out of there. Okay? That's it. For that, I don't think that I will stop my infusions just because of the side effects. I'll kind of adapt. I can take, something for pain. I can take something for nerve pain. I can take something for nausea and I can't really combat the shivering. That's weird. I can take something for nausea and I can take something for pain if needed. So I don't know. It's not enough to stop me. But good luck, everybody. Keep fighting. Please, please, please keep fighting. I hope this was helpful to somebody, and I hope I wasn't talking too fast. So yeah, this has been Tina's Adakveo video.